atrium. Do you guys remember how to identify the parts of the heart? These brownish structures on the top are called auricles. Those tell you where the atria are. So right underneath them is the atrium. So there's the right atrium, left atrium. The ventricles are further down. There's really you can't really tell where it divides, so I wouldn't ask that. Just a quick note, these arteries right here on the heart itself are called the coronary arteries. If those clot, that gives you a heart attack. Okay? If the other ones clot up towards, in the rest of the system, that'll cause a stroke. Okay. So you're not going to need to know where the left and right ventricle are, but you're going to need to know that stuff for the pathway on the written part. The AV valve, semilunar valve, you won't need to know. Ductus arteriosus, foramen ovale. Do you guys remember what those are? What's the foramen ovale, ductus arteriosus, and ductus venosus? Those are the fetal shunts, right? The pathways that blood can skip the lungs within the fetus.
Oh, okay.
Those are going to be on the written test. You should know those names and at least one of them, what it does or how it works.
The ductus arteriosus.
Yeah, there's the ductus arteriosus, foramen ovale, and then further down, ductus venosus, next to the liver there.
Know the functions.
Yeah, well, at least know one of them, how it works. It just sends blood around, so it doesn't go into the lungs.
No lungs, yeah.
Right, you don't want blood to go to the lungs of the fetus.
Don't want it.
All right, posterior vena cava is the inferior one, so we usually show it right here underneath the heart, above the liver. Right, it's bluish and round. Inferior or posterior vena cava. The anterior or the superior one's here, but we tend not to pin that. Pulmonary vein we don't have to worry about. Jugular vein is in the throat up here. Here's the jugular. So if you see a blue blood vessel going through the throat up the head, jugular vein. You don't need to worry about interior versus exterior. Just jugular. It's fine. Subclavian vein. Mine doesn't have it, but it's going to go into the arm. So if you see a blue vein going into the arm, subclavian. Azygous vein is in the back. Mine's not very good, but you can kind of see it right here. It goes down from the heart, along the aorta, down the back. That's the azygous vein, and it drains the back. Hepatic vein, don't worry about. Hepatic portal vein. You don't need to know the hepatic portal vein on the pig, but you need to know it for the written part. Know what it does, right? It's a vein that doesn't bring blood back to the heart, right? It connects to organs. And the hepatic one specifically connects parts of the digestive system to it. So learn that. So the small intestine, the stomach, they have veins back to the liver, called the hepatic portal veins. Ductus venosus, we just mentioned. Renal vein goes into the kidney. So if you see something going into the kidney that's blue, it's the renal vein. Iliac vein, if it's in the leg, I usually don't see it, right? I have the iliac artery, which we usually see really well, but the iliac vein, if you see a blue something in the leg, it's the iliac vein. And the umbilical vein we had to cut in order to expose this region, right? It was over here earlier, we cut it to expose it, so we won't be doing that one. Aorta is the big tube, right? So up here in the heart, the top one here is the pulmonary artery. Behind it, underneath it, is the aorta, right? So pulmonary artery on top, aorta below it, but the aorta is also the one on the back that I love to show from here. Brachiocephalic artery, don't worry about. Common carotid artery are the arteries that go into the neck, into the head. So if you see it, common carotid. If it's red, carotid, blue, jugular, right? The right subclavian or the subclavian arteries. So if it's red and going into the arms, it's the subclavian. If it's blue, it's going to be the vein, right? So subclavian artery, subclavian vein go into the arms. Pulmonary artery, we just discussed. It's the one on top of the heart. Renal artery go into the kidneys. Iliac arteries go down the legs. And the two umbilical arteries are right here. Okay, so that's the second column. Third column, right? Kidney, the bean shape, there's two of them, right? Ureter is the tube that comes from the kidney and extends into the urinary bladder. If you see a tube and you can't tell what it is, try to just follow it. See what connects it, okay? And you're not sure what it is, try to find where it connects to. Goes from, so the urinary system, kidney, ureter to the urinary bladder to the urethra. Okay, female urethra right there. Reproductive organs, we got ovary, okay, to the fallopian tubes or the oviduct in the pig, to the uterus or the horns of the uterus first, and the uterus itself, which is really tiny and hard to see. Right, it's right here, it's the uterus itself. Like I said, for male-female sex organs, we tend to pin the ovary for females, testes for the male, and ask you to identify the sex. Males, I don't have a male, so I can't really explain that stuff. But look for the testes, really, is what we're looking for in the males. And then the last part is the brain, right? Cerebral cortex in the front, cerebellum in the back, and those are the two parts we tend to pin.